not going to get too much into detail. What the one I'm going to be focusing on here is going to be parenteral. Enteral is anything that has to do with the GI system. So we're talking about the mouth, through the rectum, but this is through the GI system. Then you got parenteral, which is any type of administration of medication that is introduced through the break of the skin or some kind of mucous membrane, okay, such as starting an IV. Okay, so we're going to be spending a lot of time here on the parental part of it, and also topical. All right, so the enteral route, okay, includes by mouth, underneath the tongue, through the cheeks, and through the rectum. Orally or by mouth is going to be the most efficient and cost-effective way in the administration of any type of drug or medication. This is where you want a slower absorption of the medication. The duration lasts a little bit longer. If you notice, like many of the over-the-counter drugs that you do take, like aspirin or cold medication or things like that, it tells you to take it every 4 to 6 hours, right? It's because it has a slower absorption rate. Okay, slower absorption rate, also the duration of the absorption, the effects of the medication last a little bit longer. Okay, so this is through the by mouth in the stomach. Now we have sublingual. Sublingual, the medication here is placed underneath your tongue, such as nitroglycerin. Patient comes in experiencing some chest pain, they will put nitroglycerin underneath the tongue. Underneath the tongue, because it's highly vascular, it enters your circulatory system much, much faster. It has an immediate effect. Okay? So in this case, and this happens all the time, when we have a patient coming in, let's just say for chest pain or cardiac arrest, we're trying to put a pill underneath their tongue, or we're giving them a spritz of nitro underneath their tongue, and it hits the top of their tongue, or they chew and swallow it. When that happens, it goes back to this, okay? The effects are slow. It's not immediate. So if they swallow it, okay, the effects are not going to be immediate. You guys follow? So underneath the tongue, very effective.
So you're talking about spray versus the pill. So if it's
Either one. Either one. Either pill or spritz underneath the tongue.
But the spray is going to be fast versus...
Either one.
How long?
The pill is absorbed fast.
So the pill breaks down quick under the tongue?
Yes.
Oh, okay.
Yeah. It breaks down a lot faster. The spritz is a little bit better, okay? But as long as you get underneath the tongue, the effects are almost immediate. But yeah, I understand what you're saying, pill versus spray. It gets absorbed, so it doesn't get absorbed as fast as a spray, but it's still just as effective because it's underneath the tongue. Does that make sense?
Yes.
Okay. All right. So when this happens, again, do not eat or drink until the medication or drug is fully dissolved. Okay? Do not chew or swallow it. All right. Buccal, same thing. Your cheeks, inside of your cheeks, highly vascular. Okay? So an example that they have up here on this board are like throat lozenges. But you also have one example here is chewing tobacco, right? Chewing tobacco, they're either putting it on cheek or underneath their tongue because that nicotine absorbs in the body a lot faster. Okay? Rectal. Rectal is administration of medication or drug when the patient, through the rectum, when the patient is unable to take it by mouth, okay, because they may be nauseous, there may be some mouth injury. Okay, so they'll go rectally. This is very, very effective, but the problem with this is that there might be variances in the absorption rate due to the moisture within the rectum. So that may also change the effectiveness of the drug being absorbed. But again, this is very, very effective. Okay, any questions here? All right, let's talk about the parental route. Parental route. Parental route, again, is going to require some break of the skin. Okay? This is, remember that term we talked about, sub-Q, last week? Okay, here's subcutaneous, intramuscular, or IM, intradermal, intravenous, and then you also have the specialized ones. Again, we're not going to be spending too much time on all of this, only a select few. We've got through the lesion, through the artery, through the heart, inside the joint. Okay? These are all various ways in which the drug or medication can be administered. Now, rules for parenteral drug administration. Number 1 is that all equipment that penetrates the skin, that's the key point here, is penetrates the skin, must be sterile. Must be sterile. Most importantly here is the needle. Okay? If it's breaking the skin, it needs to be sterile. Other things such as the syringes, okay? Like here's a syringe. I can touch this with my bare hands. Okay, it's not sterile. Okay? What is sterile though is the tip. Okay? So once you open it from the package, you're not touching the tip. You guys follow? When you guys open up the needle, okay? Here also is the needle, okay? I'm not touching the hub because that's sterile. So remember, sterile on sterile keeps it sterile, okay? The needle, look how big that is, okay? That's sterile, so I'm not going to touch this. If I touch it, it's now contaminated, right? Everything else that doesn't enter the patient's body doesn't have to be sterile. How about the contents inside? Does it have to be sterile?
Yep.
Yes.
Yes.
What gauge is that?
This is 18 gauge.
What do you use that for? Well,
It's an 18
To
gauge
kill
needle.
someone?
This is not used to penetrate any skin.
Okay.
This is just mean. Okay. We use 18 gauge needles to draw medication out of vials. That's the main purpose of that.
okay.
Okay, but you do not stick anybody with this. That's just
What's the biggest
mean.
gauge you
Huh?
What's the biggest gauge for like penetrating skin?
We use anywhere between 20 to 22.
Oh.
Yeah, we'll talk about that later.
Yeah.
Okay. All right. So rules again. Everything that penetrates the skin and mucous membrane must be sterile. Number 2. Okay. Correctly identify your patient. Did we talk about that last week about making sure you got the right patient?
Yeah.
Okay.
All rights.
So, yeah, patient's rights, exactly. So you want to make sure that you got the correct patient. If you got the incorrect patient and you stick him with that needle, you now are liable for battery. Okay? You're liable for battery. Okay? Make sure you got the correct patient. Thoroughly explain the procedure to the patient. This is part of what we do as technologists, is you are explaining the procedure as part of education. You want to let them know what's going on. It includes not only the benefits, but the risks. You are giving the patient, you're giving them enough information so that way they can make an informed decision about the procedure. Okay, so you tell them everything. We're going to tell them as much as we can, but it's going to be the ultimate responsibility of the physician to fully disclose those risks and benefits. Okay? Number 4, document if patient refuses the drug. Number 5, okay, we are going to clean the injection site with an antiseptic. Okay? What type of antiseptic are we talking about here?
For extreme alcohol.
Okay. Specifically, you guys have had IV blood drawn before, right? Or shots taken. What are they cleaning it up with?
Alcohol?
Alcohol. Okay. In what fashion should the area be cleaned?
Circular.
Circular motion from
Inside out.
inside out. See, now you guys remember that, right? From inside out. Okay. And this is what I see a lot. I see phlebotomists doing that all the time. I'm like, come on. You're not cleaning it. And so once you go into circular motion, you let it air dry. You don't blow on it. Okay? You don't fan it. Okay? Just let it air dry naturally. Okay? And this is another thing I also see phlebotomists, nurses, and other people doing it when they're doing IVs or giving shots. Once they clean it out, they're touching it again to find the vein. What did they just do? They contaminate it again. So if you do that, you got to clean up the area again. Okay? Next time you guys get shots, be conscious of how you're getting those shots. Okay? What's the whole purpose of cleaning it if you're going to touch it again? All right. Antiseptic, again, is determined by the hospital. All workers administering parenteral drugs must wear gloves. What's the whole purpose of wearing gloves? Why are you wearing gloves?
Protect yourself.
To protect yourself from what?
Antigens.
Okay, from bloodborne pathogens such as HIV and all the different types of hepatitis. Okay, those are some examples. Like anything else, when you're performing a procedure, and yes, IV drug or medication is a procedure, and you must have a physician's order. Okay? This goes back to what we were talking about earlier, Nick. You got to understand the 5 rights of drug administration before administration of the medication. That includes right patient, okay, right drug. And the drug we're talking about here is contrast media. Okay, is contrast media a drug?
Yes.
What is in contrast media?
Iodine.
Iodine. Is iodine known to cause different types of physiological responses?
Yep.
Okay, negative responses. Okay, so you make sure you've got the correct drug, the correct dosage. Things you also want to verify on that vial is the lot number and expiration date, right? And you're also going to be holding up your vial up to the light to make sure it is clear and there's nothing in here that's going to cause any harm, right? How many times are we checking the vial?
3.
3 times for verification. Affirm, reaffirm, reaffirm. Any drug that you administer, as soon as you administer it in the patient, you want to record it immediately. Okay, it is part of our charting. You want to record the information immediately. The patient must be observed closely for a minimum of 1 hour. Patients have been known to have latent effects. So we're going to be waiting about an hour. Usually these effects occur immediately within minutes. Okay, but latent effects have been known to happen an hour later. But the longer that there is a gap in between, the chances of them having an allergic response diminishes. But again, it can happen. Okay, so we're going to keep them in our department for about an hour. Next thing here is a patient who has had a sedative. Tranquilizing or hypnotic drug may not drive home. They are fully aware of this prior to them coming to the hospital, so they may get dropped off by a friend. They may take a taxi, they may Uber it, okay? But they cannot drive home, okay? Because we're also going to give them, put them under observation before they are ready to go home. Okay, any questions so far? Okay, the equipment for drug administration that's going to be needed. First one here is the needle. The needle is of stainless steel, okay? It is metal, and it averages anywhere between 3/8 of an inch to 2 inches in length. You have the different parts of the needle, okay? You've got the hub, which attaches to the lure. This is the lure end of the syringe. You've got your stainless steel shaft. Notice at the end of that shaft, it is a pointed tip. It has a beveled, serrated edge to it. So when you insert that needle in there, it is literally cutting the skin. Okay? It is literally cutting the skin. Now within the shaft of it is a hollow area that is known as the lumen. The lumen. Okay, let's go back to the original slide here. So we have the hub, we have the shaft. The lumen down here is a hollow tube that runs through the length of the shaft. Okay, again, the end of the needle is pointed and also has a beveled edge to it. The size of the needle is determined by the unit gauge. And this is where it gets a little bit confusing, okay? Because as the gauge goes up, the diameter goes down. As the gauge goes up, the diameter goes down. Okay? Notice that the needle that I showed you up here, this is 18 gauge. Do you want to get stuck with an 18 gauge or do you want to get stuck with a 25 gauge?
25.
25 gauge. 25 gauge is very small. and very forgiving to the skin. Now, we're going to be talking about the selection of the needle early on too, because the larger the gauge, the more easier it is to inject the fluid through, okay? But what if this was contrast? Is contrast going to be what's that word I'm looking for? Isotonic. Contrast is going to be a lot more thicker and viscous. It's not going to be as easy to inject that material through a smaller diameter, larger gauge needle. Okay? Because if you go with a 22 or 25 with contrast, you're going to have to use a lot of muscle to push that contrast through. Okay? So the selection of the needle, yes, we want 22 or 25, but we also got to keep in mind contrast is going to be a little bit thicker, so maybe we can go with maybe a larger diameter needle, but also keeping in mind that you're not hurting your patient with that needle that you use. Okay? Any questions so far? All right, next one here is the syringe. The syringe. Average size of the syringe is to accommodate 1 to 50 milliliters. Remember I said cc and ml are pretty close, very similar. They're off by like maybe 1/1000th of an inch or something like that. But cc and ml are used synonymously. Okay, so 1 ml is equal to 1 cc. 50 ml is equal to 50 cc. Okay. So you have the tip, this is the lower end. Then you have the barrel, which accommodates your solution. And you have the plunger, which allows to push the solution out of the barrel. And then together you've got the needle of the hub that attaches to the lure of the syringe. And it looks like this. Okay, so rules of working with needles and syringes. Number 1, syringes or needles are disposable and for one-time use only. Right? This is good aseptic practice. We don't use needles on multiple patients. Okay. Number 2, syringes and needles are to be disposed of appropriately in containers. Okay, they're specially marked containers. Sharps. They're called sharps containers, and they're usually delineated by the color red. Anytime you see red, that means hazardous. Okay, and it looks something like this. Okay, these are your sharps containers, all in different sizes. All right, they're puncture proof. They also have a label here that has a biohazard sign to it. When using these receptacles, you want to close the lid, lock it, and obtain a new receptacle. We usually don't go all the way to the top. Okay? We usually go maybe about 4 or 5 inches before it reaches the top, as a general rule, because if it goes all the way to the top and you're trying to drop stuff in there, you think there's going to be needles sticking up? Okay, and you're trying to drop something in the bucket, you think you might be accidentally stuck with that? Yes or no?
Yeah.
Yes, okay. So we don't want it going up too high. So as you're dropping stuff in the bucket, you're not going to get yourself stuck with a needle that's already been in there, a dirty needle. All right, and this is not like a trash can, guys. If it falls all the way to the top, you don't want to be stepping on it to make more room. Okay? So once it gets near the top, we're going to seal the lid, lock it, and ask for a new receptacle. Okay? Again, they come in different sizes. From a very small to trash can size. Sharps containers. We use this in the cath lab because we got needles all the time. Needles, vials. All right, number 3. Used needles must not be recapped. What do we mean by used? That means it's already penetrated the patient's skin, right?
Mm-hmm.
Do you guys remember the story about my cousin? I said she was working with somebody who had hepatitis. She gave intramuscular injection of something. She got distracted, put the syringe and needle down. Okay? She was reaching for something and she got stuck by it. Remember that? When you guys use a needle, don't place it down. Get rid of it immediately. Put it in one of those what?
Sharps containers.
Sharps containers, those sharp receptacles. Get rid of it. Okay? If you needed to make another injection, get another needle, a brand new needle. They're only a couple of cents. It's not a big deal if you toss it. Get a new one. Okay? Safety first. Get a new one. All right? So used needles must never be recapped, because you're recapping it because you want to save it for later. Just get rid of it. That's stupid. Just get rid of it, okay? So, you saw me doing this. Okay, I'm recapping it. Oh, did you see how it just slipped? When you slip, trying to recap it, that's what happens. Okay? So that's why you don't recap. Now what I actually have here is a blunt tip. Okay? It's a blunt tip, so I'm not going to get myself stuck with it. This is a safety needle. Okay? But that's why you don't recap, because you can actually miss the cap and stick yourselves. We have old school doctors, when I'm working procedures, they're constantly doing this. I said, put it down, step away. I'll take care of it. Exactly. Put it down, step away, I'll take care of it. All right?
If it's never supposed to be recapped, is it okay to, actually do that the acceptable way and toss it in
I'm going to show you that in just a minute, okay? So the question is, the next slide here is talking about, okay, so used needles, do not recap, used needles dispose of immediately. Never place a used needle down by the side. Number 6, if a needle does not have a protective mechanism, whatever, okay, let's just say you did use it, okay? Still there's no need to recap it and dispose of it. Just put it in the receptacle, okay? Oh, now let's just say I accidentally dropped something in the receptacle. I'm going to go in and dig for it? No. Once it's in there, it's done. Okay? There have been times where I've accidentally tossed things in there that were a few $1,000s within the receptacle, and I went, and I just walked away. Okay? Hey, Tony, did you see that so-and-so instrument?
No.
I'm like, nope, never saw it. Don't know what happened to it. Okay? Yeah, so you don't go digging in there because you're going to hurt yourself. Okay? All right. Now, there is such a thing that is known as the one-handed scoop method. It's talking about recapping, and it's in the book. Okay? I'm bringing this up because it's in the book. That if you need to recap your needle, you're only going to use one hand. Okay? Only one hand. The other hand is behind you. Okay? Or just, you're not using it, okay? Your cap is on a flat surface. You're going to take your needle, you're going to put it through the opening of that cap, you're going to scoop it so easily, okay? Let the cap drop, and then you're just going to snap it on. That's what the book discusses. Now, I'm going to tell you as your instructor, and you take this with you, if you're going to take anything from this class, this is what I want you to take, okay? Do not ever recap your needle. What are you going to do with it?
Throw it away.
Throw it away. If you need another needle and syringe, what are you going to do?
Grab another one.
Get another one. It's only a few cents. Okay? I think your life is much more important than wasting a couple of pennies. All right?
Is it because of, maybe they mention it because of maybe spreading the infection or something because of the naked needle?
They're mentioning it because sometimes you're going to be scrubbed in a very sterile procedure, a surgical procedure. So you have your sterile tray,
Right.
all right, and so you may not be able to leave your area because you're going to be in a confined area. Remember your sterile corridor? Okay, you are stuck there as a scrub tech. you are not to leave the area, because when you leave that sterile corridor, there's a chance of you, contaminating yourself. So you're going to have, instead of me going to a receptacle and tossing it, it's going to be right here on my table. Now, I don't want a needle laying there on my table where I can accidentally stick myself. So before I lay it on the table, there's my cap. Okay, there's my cap. I'm going to take my needle, scoop it up with the cap, then I can put it at the edge of my table.
Would that contaminate some part of your table as well? Because if it was stuck in a patient and it's put...
Well, that's the patient. It's their germs.
Oh.
Yeah. If you can't, just don't use that on the patient.
Yeah.
Yeah, that's their germs.
Okay.
Yeah. Okay, that's their stuff. All right. All right. If you accidentally stick yourself, okay, and I hope this never happens, but if you do, injury should be reported as soon as possible following the incident. Okay? And so I'm going to tell you one of my stories. This was years and years and years and years ago. Okay? We had a patient who came in with an acute MI. Do you guys know what an acute MI is? Okay, an acute myocardial infarction, full-blown heart attack on our table. Okay? Cardiac arrest. Patient was full-blown HIV positive. Okay? And so I was scrubbed in on that procedure. And during the procedure, in haste, and this is another thing that I want to tell you guys about later, but in haste, I was rushed in a hurry, because in a medical emergency like this, you're kind of like, boom, 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 let's get this done, let's save this guy's life. Okay? So you're rushing. So in haste, what happened was, one of my instruments pierced my glove, stuck my skin, and I was bleeding. Okay? So in my head, I'm like, oh God, I just contracted the infection. Okay? But it was a clean instrument that pierced my glove, pierced my skin. Now, but if it was a needle, okay, I probably wouldn't be here. So when you get stuck, even in this situation, it was a clean instrument. It was actually a clean needle. I'm saying instrument, it was a clean needle, and it stuck me. Okay? I took off my gloves, went to the sink and bled it, pushed it out, and washed right away. Thank you, sir. Okay, thank you. And then I reported it immediately. Okay? But again, me attracting that infection was almost zero because it was clean and I was wearing gloves. Okay? But remember what I said about my cousin. Okay? Finish what you started. Don't get distracted. Okay? Don't let anybody come in and distract you. If they're coming in, you tell them to wait. Let me finish what I'm doing first. Okay? And don't ever, ever rush. Don't ever rush where you start to lose control of safety. There have been many times where doctors are rushing me during a procedure. I said, give me a minute. Because I learned from that day, that's give me a minute, I'll get to it. Okay? Because what I'm thinking about first is my safety above all others. Okay, I'll get to it. I can work fast, but I'm not going to rush. Okay, because when you rush, that's when accidents happen. Okay? Safety first. Okay.